this presentation, we will cover the delivery of information to clients and what it looks like to get their informed consent to treatment, as well as one method of keeping good session notes. While you may have read or heard about all the aspects of informed consent in counseling, it may be helpful to hear an example of how this is actually delivered to clients. As we do so, keep in mind that the delivery of the client's rights and responsibilities may depend on the setting, and there is almost no setting in which you can communicate everything identified in your course material, at least not verbally. We'll touch on this in a minute, but it's for this reason that having really solid and thorough written information to provide to clients is really helpful. So imagine you are a licensed counselor working in an outpatient clinic and you have a new client who you have set up an intake session with. Hopefully, you will have a number of helpful and informative forms that provide your client with all of the necessary information she or he needs to be educated on the treatment process, including things like the cost of therapy, the limitations of confidentiality, what to do in case she or he needs to cancel a session, how to reach you or another professional in the case of a crisis, etc. So you greet your client, you show them to your office, and begin the first session. You might say something like the following. Welcome. I'm so glad you're here, and I hope you found your way to my office without any trouble. To get us started, I'd like to communicate my plan for this time with you. First, before you share any personal information with me, I'd like to walk you through a few of the forms that you received in your intake packet and highlight a few things that may be especially important as we get started. Second, I'll introduce myself to you so you know a little bit about my training and qualifications, as well as a little bit about who I am as a counselor and how I approach the process. Then I will give you an opportunity to ask any questions that you haven't already asked. And of course, please feel free to interrupt me and ask questions at any point. Finally, I'm very eager to know how I can be helpful to you, so with the time we have remaining, I hope to get a really good sense of who you are as a person and what concerns you're bringing with you to address in counseling. Does that sound okay? Great. At this point, you might simply follow the outline of the session that you just provided to your client. You may have 10 minutes to get through all this, or you may have more time. But one of the challenges of communicating all the necessary information to clients about the counseling process is that you could probably talk for a really long time before ever giving your client a chance to share her or his concern. And you don't usually have as much time as you need. To make this even more difficult, in the first meeting, a helping professional is most often also trying to establish rapport. And one of the best ways of doing that is to take time to listen to the client's concerns. So you might see that in the first moments with clients, there's a pretty significant balancing act going on for most counselors. This is why many professionals find it best to use a combination of written and verbal methods to obtain informed consent and communicate with your client her or his rights and responsibilities. However you choose to deliver the information to clients, it's important to remember as the professional, it's your responsibility to provide your client with the opportunity to be informed and give consent before your client shares personal information with you. Every once in a while, you may have a client who is so eager to share what is going on that she or he just dives right in, spilling it all. And it's important that you gently redirect this person or interrupt her or him before too long. As you explain elements of the counseling process and cover topics such as confidentiality, benefits and risks of therapy, or your personal background and approach to counseling, it's your responsibility as the professional to make sure your client understands the information you are presenting. To highlight this, imagine your client is a child or adolescent. If the client is a minor, like under 18, it is especially important to communicate in a way that she or he can understand and assess whether it seems that she or he does understands, and make sure that a parent or guardian who can give consent on behalf of the minor is present. If you recall the moral principle of autonomy, providing your clients with the information necessary to make informed decisions about their own treatment is directly related to this principle. Let's change gears and briefly discuss record keeping, one of the most important responsibilities of the helping professional. The standard of practice is to keep a record of all client contact. This means emails, phone calls, and of course, sessions. Records should also include consultation about the client with professional colleagues and correspondence with other health professionals who you may be coordinating your care of the client with. For simple correspondence, oftentimes a very brief note or one-page log will suffice. Progress notes, on the other hand, can require just a little bit more. It's important to keep balance between spending too much time writing progress notes and too little or no time at all. Many professionals try to keep this to 10 minutes or less. Consequently, this is why many counselors consider an hour of therapy to be 50 minutes. The extra 10 minutes are to document the session. One of the methods for documenting sessions with clients is using what is called a SOAP note. SOAP is an acronym that stands for Subjective Information, Objective Information, Assessment, and Plan, and using this format allows clinicians to quickly cover the essential aspects of a session with clients. The subjective portion of the note is usually about the client's report. This is a good place to put direct quotes from the client and write down major themes of what the client reported in the session without giving too many specifics. For example, you may write, "The client reported she made significant progress towards treatment goals over the last week. A significant portion of the session was used to discuss the impact of the client's experience in her family of origin on her current behavior. She stated, 'I'd never realized how big a deal some of this stuff still is to me.'" In the objective portion of the note, a clinician will write down only what was observable and concretely true. For example, the client was dressed formally and neatly groomed. She laughed and cried in the session and leaned forward when talking about her brother. The assessment portion of the note would be the appropriate place to include your clinical assessment and judgment of what is happening in the session. You can include client strengths and limitations, areas of insight or lack thereof, or things such as your assessment of how well the client seems to be functioning. Finally, the plan portion of the progress note would include your plan of action with the client. This could be as simple as continue meeting with the counselor, work toward increasing rapport and trust with the client, or the client will complete homework assigned in session on her own time. Each of these sections can be short, concise, and to the point. It's possible for a clinician to write this note in about 5 or 10 minutes. It is also a good idea to indicate in your note whether or not the client was suicidal or homicidal and whether or not she or he reported any chemical or drug use. Finally, remember that a progress note is not the same as a process note and should be kept separately as part of the official client file. In this presentation, you've seen an example of how to deliver important information to clients and obtain informed consent. You also learned about keeping good records and were shown a template for what a progress note might look like. It's one thing to read about these practices in a textbook and a whole other to do it in practice. There are many different approaches, so I hope that as you learn, you will be open to asking questions and finding out how other professionals do it as well.